Associate Executive Director of the Permanente Medical Group, Stephen Parodi, joins me now from San Francisco. Thank you so much, Doctor, for joining us. You help oversee dozens of hospitals with millions of patients in California, which has been really hard hit by all of this. So give me a sense of just how busy your hospital emergency rooms are right now.
I'm going to tell you, this is the busiest we've ever been. And I can't believe I'm saying
including during the COVID pandemic.
that includes the COVID pandemic. It includes the Omicron surge. So literally, we have hospitals that are busting at the seams. We are at a census in Northern California of 3,500. And just to put that in perspective, normally we run about 3,000. So this tridemic of RSV, flu, and COVID all at the same time is pushing the hospitals to our limits.
I mean, how have you been able to make accommodations for this? I understand some hospitals have had to had patients sharing rooms and so on. How do you cope with this huge influx?
So a lot of advanced planning. So we actually literally hired thousands of nurses in the wake of the COVID pandemic. On top of that, we had already done a lot of planning around additional beds. And as you referenced, using hallways if necessary. And we've, of course, actually opened up some tents again, just like we did with the prior surges. So putting that all together, we've been able to handle the current surge. But my concern is that we're going to see more. So flu has literally gone up about a month earlier in the United States and in California compared to what we usually see. And we're predicting that we're going to see even more flu activity over the coming month of December and January.
So let's explore that. I mean, why is that? Because these respiratory viruses, I mean, we know it happens at this time of year every year, flu and RSV particularly. Now you're adding in, of course, the extra factor of COVID. But why flu? Why is that flu and RSV? Why are they so bad this year?
So I think what's changed, Kim, is, of course, our behavior. The last couple of years, we were masking up, we were isolating. And of course, society has opened up over the last several months. And so a lot of those viruses that we typically were exposed to, flu and RSV, are now back. And we're getting exposed. A lot of us probably weren't as exposed and didn't have as much natural immunity from the prior years. And so we're just seeing increased activity. There's one other fine point I want to make here, Kim, which is that we've got a lot less people getting vaccinated. And I've got to make a plea to everyone out there. It's time to get that flu vaccine. It is not too late. And we're lagging in our numbers, whether it's children, pregnant women, and all other adults. And you've got to go out and get that flu vaccine.
Yeah, absolutely. And an essential reminder there. You just mentioned children. What's scary for so many parents I talk to is how many young children are in hospital as well. Is that what you're seeing?
Yes, it's been actually surprising to see the amount of our pediatric hospitals being literally full. And that includes our neonatal as well as pediatric intensive care units. We've literally been on calls with our state colleagues as well as other hospital colleagues to manage the census across the entire state. And so it's really requiring that level of coordination to make sure that we can get everyone the care that they need.
So for people out there, they're hearing about hospitals being full, patients having to go into hallways and so on. So they may not want to go into hospital. So maybe you can give people a sense, because you're an infectious disease specialist as well. When should patients actually go to the hospital, and when can they take care of themselves at home, do you think?
Well, certainly what we want people to do is to seek care when they need it. And there are a lot of online resources. So if you're looking for information, going to the CDC website, going to your healthcare workers website, and if you're having problems, making that phone call early. But the symptoms that really should drive you to go into an emergency room, if you're feeling short of breath, you are having trouble with cough, fever that's not controlled with over-the-counter remedies, like Tylenol, you should be going and seeking care in your emergency rooms. The thing that I got to say, though, Kim, is prevention is still key here. So avoiding congregate settings, if that's at all possible, washing your hands, covering your cough, don't go to school, don't go to work if you're sick, and really assessing your own individual risk when it comes to mask wearing. And if you're in a higher risk category, you're immunocompromised, think about wearing that mask if you're going outdoors.
Yeah. Essential advice for everybody watching out there. Thank you so much, Dr. Stephen Parodi. Really appreciate it.
Thank you so much.